Make America Healthy Again has become a major slogan in national health policy conversations. But what does it actually mean for children's health? As the federal government releases sweeping recommendations, there remains a bigger question. Will these ideas translate into policy that improves kids' health? This is Child Health Advocacy and Policy, a podcast from Rice University's Baker Institute. We go beyond the headlines to examine the data and decisions shaping children's health. I'm Dr. Heidi Russell. Preventable diseases such as measles and whooping cough are making a trembling comeback, raising urgent questions about vaccine policy and public trust. As new federal guidance and political debates reshape the landscape, what does this mean for the health and safety of children? Today, we're going to dig into resurgence of vaccine-preventable diseases, the spread of misinformation, and the growing policy debates shaping childhood immunizations. I'm delighted to be joined by two of the nation's leading experts on this topic, Dr. Peter Hotez, co-director of the Texas Children's Hospital Center for Vaccine Development, and Rekha Lakshmanan, executive director of the Immunization Partnership. Let's get to it. I wanted to just really kind of go back a little bit and remind everybody why we're even having this conversation. Why are childhood vaccinations such an important part of public health, both in Texas and nationally and actually internationally?
Vaccines have been one of the great public health triumphs of the United States. We eliminated measles, which during the 1980s was the single leading killer of children globally. 3 million kids, were dying every year, and they still cause a lot of deaths internationally. But, we eliminated measles in 2000. And through a pretty significant vaccination campaign conducted in the United States, we also eliminated polio, and then we have made major strides in reducing pertussis and tetanus and diphtheria, which are largely at one point were spoken about purely for historical interest, although unfortunately pertussis is also coming back along with measles. And then, of course, we've had the great triumphs in eliminating causes of bacterial meningitis, such as Hib meningitis, Haemophilus influenza type B, which when I was a pediatric resident in Boston in the 1980s, I was admitting a kid every couple of weeks with Hib meningitis. It was a devastating condition that would lead to permanent neurologic injury, or sometimes the child wouldn't survive, and taking care of those kids in the pediatric ICU, both with Hib and meningococcal meningitis, was terrible. And now we don't have to talk about those illnesses up until the beginning of 2025, when they've come roaring back. So that's the heartbreak. I mean, these are unforced errors. We secured great public health triumphs, but as Elie Wiesel once famously said, humankind's weakness is not in achieving victories, but in taking advantage of them. And unfortunately, we're now in a position where we're not taking advantage of them.
We're a victim of our own success. We used to not see these diseases because of vaccines. We have a generation who has not seen measles up until, last year, or have had to encounter pertussis. And so when it became out of sight, it became out of mind. And now we're starting to see these diseases come roaring back and unfortunately being normalized in our daily lives.
Yeah, I practiced pediatrics for about 35 years, and I have never seen a case of measles. I stopped practicing before the measles started coming back. So if they're so critical, and if we've done such a great job, and we know the science behind it is good, can we go back to why we have this debate to begin with? It's before COVID, we were having a conversation about vaccines being a problem. It was even probably before the false links between measles vaccinations and autism. Can either of you remind me of the history of why we are in this space now?
Well, there's an historical thread going back to colonial times, and then there's the more modern era, the anti-vaccine movement. I mean, even before the first vaccine, which was developed by Edward Jenner in Gloucestershire, England, for cowpox, there was something called variolation, where you actually gave an individual a small dose of the smallpox virus, and you put it on a cotton swab in the hopes that it would cause a mild case, which most of the time it did, although 2% of the time it could cause full-on smallpox. And and has significant mortality attached to it. There was a big movement against doing that, and even Cotton Mather, who was so important with his brother Increase Mather in their leadership for the Puritans and the founding colonies. He got a Molotov cocktail or the 18th century equivalent thrown into his home. So there is that thread of anti-vaccine activism around health freedom, medical freedom. You can't tell us what to do, and especially around compulsory vaccinations. And it's gone in various fits and starts. I think, if you started going now to the 1950s when parents were terrified about polio, and then first the Salk and then the Sabin vaccines became available. I think that was a golden era where, parents were so grateful that they didn't have to go into the summer and fall worried if their child was going to be permanently, paralyzed or even worse because of poliomyelitis. And that spurred a whole generation of young biomedical scientists at the time, including myself, who wanted to become vaccine scientists. That's why I did my M.D. and Ph.D. in New York to develop parasitic disease vaccines. But then there was a kind of a resurfacing of it all, and it went through several iterations. And so I do benchmark this kind of modern era, and I'll use modern in quotations because it goes back almost 30 years, to false claims around vaccines causing autism. And it cycled through the MMR vaccine, and that was the Wakefield paper in The Lancet that was discredited and retracted and followed by a large cohort study showing there was no association. And that was 1998. And then Kennedy came on the scene in 2005 and wrote an article in that very important biomedical journal called Rolling Stone, claiming, okay, if it's not MMR, it must be thimerosal preservative that used to be in vaccine. And there was this, kind of Pyrrhic game of whack-a-mole where every time an anti-vaccine group would make a false assertion about a different vaccine, the scientific community would investigate it, study it, show, in fact, there was no association. Then they'd come up with something else. And that thread still continues. And we can talk about it today, that there's this sort of continuing volley of drumbeat of false claims around vaccines causing autism. But then two other forces got piled on top of it. And that was one around 10 years ago. The old health freedom, medical freedom arguments resurfaced, and especially in states like Texas, where anti-vaccine groups started getting PAC money, political action committee money. And so that's when it took more of a political turn. And then the third iteration, also piled on top of that, is this wellness and influencer industry that is pushing various alternatives to vaccination. And even Mr. Kennedy now has adopted that. If you listen to his rhetoric, he uses more and more of the language of the wellness influencers. And so there's a financial incentive behind the anti-vaccine movement as well. So that's the game changer, I think, is where the political and financial drivers of anti-vaccine activism.
Going back to sort of that second stage Dr. Hotez mentioned about the politicalization of it. I mean, we can kind of trace it back to 2015, which was when, if we recall, there was a large measles outbreak in Disneyland in California. In that year, the California legislature decided to remove non-medical exemptions. Parents who decided to opt their kids out of school-required vaccines, they decided to remove that. And that kind of kicked up a new firestorm and what I call sort of the new generation of the anti-vaccine movement. And then specifically looking at Texas, what happened was we had a lawmaker who was trying to do the right thing, but didn't realize what he was going to unleash, and filed similar legislation. And what we saw was, as Dr. Hotez mentioned, a much more assertive, aggressive anti-vaccine movement that really started to get involved in politics and raising political action money and supporting lawmakers who supported their platform. And that kind of created a model for other like anti-vaccine interests and activities across the country.
That leads me to the new recommendations and actually more to what we've seen over the past year. This history is really helpful because it suggests that maybe there's some underlying movements that are really not exactly related to justified or scientific concerns around side effects of the vaccines. Maybe
Yeah,
saying that
yeah,
correctly. Yeah.
that's correct. So what happened was, Mr. Kennedy, who's a very outspoken anti-vaccine activist, and I have a many year relationship with him after speaking with him at the request of the NIH and realizing he's not very interested in the science or unable to understand the science. He was appointed Health and Human Services Secretary at the beginning of last year, around this time year, and he was then appointed soon afterwards. Well, this is when our measles epidemic in here in West Texas was beginning to accelerate at the end of January and then move into February, March, which, by the way, is the time you usually see measles, right? Measles in the pre-vaccine era was seasonal. It was late winter, or early spring, and right on cue, that's what happened in West Texas. And as that was going on, we had almost 100 kids hospitalized for measles and with measles pneumonia or measles encephalitis, and we had 2 deaths among two unvaccinated school-age kids who were otherwise well. And so this is when Mr. Kennedy decides to start making false public statements about the MMR vaccine. He says it was even before ACIP, he started saying it was a leaky vaccine, which is absolute nonsense. Or he said it declines in immune protection by 4% annually, and that's why it's better to get the virus, which is absolute nonsense. When you look at the data, there is maybe a 0.04% decline in protection annually. That's off by 100-fold. And then start saying the vaccines, the MMR vaccine, the measles, mumps, rubella vaccines, contaminated with aborted fetal remnants, and it's absolutely not true. And then, interestingly, he does a shout out to the wellness and influencer industry. He says, well, you have a viable alternative in getting the MMR vaccine, and that is you can get an infusion of vitamin A, budesonide, and clarithromycin. And there were these docs in West Texas that were setting up clinics or opportunities for that. And it doesn't do anything to halt the progression of measles, especially during an epidemic. And you're scratching your head saying, where the heck did that come from? And then, because that was different from what I spoke to Bobby Kennedy a decade ago. And the answer was, well, this is the version 3.0 of the modern anti-vaccine movement. Version 1.0, false claims around autism. Version 2.0, as Rekha was talking about, the politicization of it around health freedom, medical freedom. Version 3.0 is the wellness and influencer movement, or industry. So this is Kennedy now using the language and pushing the snake oil of the health and wellness and influencer industry. And he's been off to the races ever since. Every week or so he comes up with a new zinger. And Heidi and Rekha, I like to think my TV career is winding down with the winding down of COVID, and unfortunately, Mr. Kennedy seems determined to call me out of retirement. He just comes up with all this stuff, and the latest version of that, of course, is the disaster that has become what was ACIP.
So I'm glad you brought up ACIP because, it sits under the CDC, which sits under Kennedy in terms of the sort of official structure of the United States and making public policy recommendations. The ACIP has historically been the recommending body for how we give childhood vaccinations. I got the joy of watching the last ACIP meeting in December, where they were talking about the hepatitis B vaccines that are normally given, have been universally given to newborns in the United States and been very successful at preventing hepatitis B vaccine or hepatitis B in newborns. And so watching that and having otherwise participated in guideline development in other settings, I really felt like the conversation was different in that meeting than had been in other guideline meetings that I've participated in outside of that. So,
It's sort of like an out-of-body experience. You watch those, and it's this odd parallel universe.
it brings to mind sort of this concept of evidence and using evidence, but picking and perhaps choosing the evidence you want to present to adjust the story in the way that you want it. That at
I
least
mean,
that was
I mean
my
that is the anti-vaccine. That's part and parcel of the anti-vaccine playbook. You pick various facts or factoids, and sometimes you don't even accurately reflect the true fact, and then you string it together to create a false narrative, and they're very good at that. There's another name for that. It's also called propaganda. And and by the way, and like propaganda is people like Hannah Arendt or Anne Applebaum or Ruth Ben-Ghat will tell you the goal is not necessarily even for you to believe the propaganda. It's so you don't know what to believe, which is equally effective. And so, I stopped listening because any of the CIP meetings because they're all fact free, just like the White House press conference was about the Tylenol and autism. I mean, there was just no intelligent life there, and it was completely silent. It was completely without any scientific or evidence base. And this is what you have now with ACIP. It's Mr. Kennedy has fired its members, including a member of our faculty at Baylor and someone near and dear to all of us, Dr. Julie Boom, who would have been an amazing member of ACIP, and just replaced them with ideologues in order to create what's equivalent to some kind of show trial, using the old metaphors from Stalinist Russia. I mean, it's really awful what's happening. And the consequence is that anyone who really does care about child health and care about child health policy, you simply cannot rely on the ACIP anymore as a source of truth, or certainly not as a source of wisdom. And so it's very dark how they've transformed ACIP into this monstrosity.
We look at these guidelines, and I can't even say recommendations. It has a local home effect. And when we're talking to pediatric colleagues of Dr. Hotez's in around Houston and across the state, I mean, they're starting to see and feel the effects, with more parents confused and asking questions, and even with a little bit of a skepticism. Do you really know what you're talking about? What is happening is we're losing sight of the people that we're trying to protect, which is children at the end of the day. I mean, they're the ones that end up being serving as the football being kicked around. At what point are we going to get to where we start to see more and more lives of children either winding up in the hospital or, even worse, dying?
Yeah, I mean, I was invited to speak to an annual meeting of the Harris County Medical Society, and this was their family medicine group. So it was about 120, 130 family medicine docs, and having that discussion with them. And it turns out that they are under siege, right? They have all of these parents coming in because they're family medicine docs, but of course they do a lot of pediatrics, and these parents are coming in sometimes in a very militant way and not wanting to vaccinate. And they said they've seen one-off instances of this here and there over the years, but never this kind of steady drumbeat of parents consistently wanting to opt out of vaccinating their kids. And so that there's no doubt that a big piece of that is the spillover from all of the anti-vaccine propaganda and rhetoric coming out of the Department of Health and Human Services and those groups they're aligned with them, and so they're dominating the internet, they're dominating the discussions, and it is having, even though vaccine policy is, someone like Rekha can detail for us, is that at the state level, the actual practices of what we do, the influence of Kennedy in the Health and Human Services Department is still very important on an advocacy point of view, but in a negative way. So no question, this is seeking to undermine our whole vaccine ecosystem, which was always fragile, and it doesn't take much to derail it and invite these illnesses to come back, and that's what's happened now. So, measles, even though we've not officially lost our elimination status, because we haven't tied all the various epidemics over the last year together yet. Maybe we will, but measles is back, Heidi. I mean, there's no question about it. And measles is not alone. Pertussis is back. We had a six-fold rise between 2023 and 2024. 2025, I haven't seen the final numbers yet, but it's pretty much looking the same or worse. So whooping cough is back. And now the list is going to follow because, as you pointed out, with the most recent recommendations to halt recommending 6 other vaccines, including, meningococcal meningitis, which is such a horrible disease, one of the worst diseases I've ever had to take care of for kids in the ICU, or rotavirus infections. The impact won't be seen immediately. It takes time for this thing to unfold, but it will unfold. My prediction is, unfortunately, a year from now, maybe we'll do a follow-up. Things will be looking even darker than they do right now. This thing still has a lot of gas, a lot of momentum.
One of the things that really bothers me about the new guidelines, and it's a kind of a process procedural thing. So not only did the ACIP change its membership and sort of its flavor, but these new guidelines were not presented at ACIP. So the only one that was discussed in that 2-day December meeting was the hepatitis B vaccine. And the way they came upon their decision of how to recommend it was sort of by consensus. It wasn't by any sort of data. In fact, mostly what they said was more data is needed. We should do these other types of studies. These are the things that are questioning. So they didn't actually demonstrate a need to change the hepatitis B vaccine. What they did was demonstrate that they needed to do more research around it. Then we pause for a month. Everybody goes away for a holiday or a break or whatever, and we come back to an entirely new guidance that was not actually discussed or approved through the ACIP. So these are guidances that 2 people wrote, and we'll link the report in the show notes. It's like a nice report of all sorts of cited information, but again, not through any sort of review or regulatory committee that we would normally trust the process of. And so that leads me to some trust issues. I don't know what that's going to do to other aspects of public health, which are relying on the federal government to provide guidance and recommendations. But maybe I'm just speaking about my own concerns around this.
Well, I mean, look at the decision, right? I mean, the decision was to adopt a vaccine policy along the lines of another country, Denmark. Why did they pick Denmark, right? I don't think it's related to the invasion of Greenland, but who knows these days? But I think more likely it was because what they did was they needed, Kennedy will look for any excuse he can to make vaccines unavailable, and his team. And so what did he do? He looked at all the European countries or NATO countries and say, okay, which one gives the fewest vaccines? Let's go down the list. Oh, I see Denmark. Denmark is the fewest vaccines. So that's what we're going to do. We're going to pick Denmark. And so let's look at that. 2 of those vaccines are for rotavirus infection and meningococcal meningitis. So rotavirus, right? In the pre-vaccine era, we had 50 to 70,000 hospitalizations for rotavirus every year in the U.S. among kids, mostly in the winter. It's a seasonal virus, terrible diarrheal illness, even significant numbers of deaths, $1 billion in healthcare costs. That's what he wants to bring back. So that's one. And then the other was meningococcal meningitis, which we give 2 vaccines for, one for meningococcal meningitis type B, the other one ACWY. I've taken care of kids with that where they have purpura fulminans, and as you know, then it affects your coagulation systems. It causes not only disseminated intravascular coagulation and sepsis, but it causes gangrene of the distal parts of the lower extremities and upper extremities. You lose your fingers, you lose your toes, you lose your feet. It causes permanent neurologic injury when it causes meningitis. It's a horrible, horrible illness, one of the worst I've ever taken care of. He wants to bring that one back too. And they were very dishonest about it when you read their statement, because they said they based this on consensus European vaccines. There's no such thing. There's no consent. Each country looks at the epidemiologic profile of their illnesses and makes a decision. He picked it because it gives the fewest vaccines. There's no science behind it. And then this whole business of now there's going to be no more coercion of parents. This is gaslighting. I used to practice pediatrics. You don't coerce parents. What you do is you say, look, here are the risks of the disease. Here are the benefits of vaccination. And today I think we should vaccinate against disease XYZ. And parents would understand it because the pediatrician took the time to explain it. That's part of our pediatric training. It's this toxic combination of gaslighting, outright false information, and an unspoken agenda to make vaccines unavailable for kids in the U.S. with no obvious benefits for those kids.
I think these days, education is now seen as coercion. We've been seeing that kind of at a policy level also, for the past few years. Earlier this week, I met with a father who lost his son to meningitis years ago. And his son was not vaccinated because the vaccine was not mentioned to him, to his father, and it wasn't required. When you're sitting across the table talking to a father who lost a son, it's been some time, but the pain never goes away. His son died in 24 hours. He's a college student. By the time Greg found out his son was in the hospital, got over there, and then 24 hours later, he died. We have to remind ourselves that there are families and there are people out there that have suffered losses from these diseases that are easily preventable.
Well, we're going to be seeing more of them and having that opportunity to have discussions about the treatment and long-term consequences of the diseases instead of the unclear long-term consequences of the vaccines. I want to turn quickly to Texas. What do we think is going to happen in Texas? We're coming into some interesting times. Do we think that Texas is going to adopt at the Medicaid level in particular these new guidelines? And what do we think that will do for our children here in Texas?
Right now, the state recommendations have not changed. So that's a good thing. The state continues to follow the original CDC schedule, which is now the AAP schedule. It's one of the many million-dollar questions. We know policymakers in the past have been pressured to advance the anti-vaccine agenda. We've seen lawmakers in the past put pressure on the state health agency to decouple the old ACIP recommendations and follow some alternative schedule. This was around COVID. When ACIP made the COVID recommendations, we saw some lawmakers make a stink about it. And immediately the health department capitulated, changed their recommendations. But for us in a state who essentially started the firestorm of measles last year, and those 2 young children dying in the middle of a legislative session, and we saw lawmakers kind of turn a blind eye and kept moving forward, that's the environment that we're currently operating and working in. There's not necessarily the state agencies, of course not, but when you look at state leadership, they're looking and they're paying very close attention to what the feds are doing. Secretary Kennedy came down last year and with a lot of fanfare around, a MAHA bill. There is this intertwinedness that we're going to have to keep a really close eye on.
What's interesting is what's happened across the country. The 2 major professional agencies, professional organizations for pediatrics and for obstetrics, the AP, American Academy of Pediatrics, and ACOG, the American College of Obstetrics and Gynecology, are basically in defiance of what ACIP is doing, which we've never seen before, right? They're saying, no, stick to the original guidelines. We've also seen now these coalitions of states form. Massachusetts has entered into an alliance with New York and New Jersey and Connecticut, and perhaps some other northeastern states, I think Maryland, to create their own parallel set of guidelines. The western states have done the same, California and Washington and Oregon and Hawaii. And I think that's unprecedented. The states get together and saying they no longer trust the U.S. federal government to implement things that'll protect our children. There's so many policy and other questions. What do the insurance companies do? For now, they're reimbursing, even despite the ACIP recommendations. I saw Dorit Reese post something, or maybe it was in an email, who's, well versed in vaccine law. She said right now the insurance companies are still reimbursing, but in time that may stop. During COVID, we learned a lot about how the pharmacy chains operate, and the pharmacy chains have chief medical officers, and they have committees, and they meet based on ACIP recommendations. And, all the big pharmacy chains, CVS, Rite Aid, Walgreens, they set policies. And which ones are they going to follow? Are they going to follow now the federal government, or do they follow these coalitions of states? And what happens if one state within the coalition does something differently than from the others? It's caused utter confusion, which I think is probably by design. That's what these guys want, Health and Human Services. They're chaos agents, and they thrive on that.
As we're talking, and as I've been following these vaccine issues over the past decades or so, this is one of those where I know I sometimes feel quite hopeless, especially as I was watching the ACIP meeting the last time. And I know my pediatrician friends feel overwhelmed and sometimes hopeless. Listeners are confused. Parents are confused. If someone who's listening to our podcast wanted to do something, take action, or take care of themselves in the best possible way, what would the one thing that you would recommend be?
Number one, what you just shared and feel, Heidi, is exactly what they want all of us to feel. They want us to be scared. They want us to be confused. They want us to feel hopeless. You look at our issue, which this is what we're laser focused on, but really it's a symptom of kind of the larger uncertainty we're all feeling, really, frankly, around democracy. I mean, it's one piece of that larger picture. They want people to retreat. They want all of us to kind of throw our hands up in the air and say, okay, I'm done, let's just see how it plays out. The best way to resist and to push back is to continue to stay engaged and continue to stay informed. And I think it can happen in many different ways. Talking to your pediatrician, following trusted leaders like Dr. Hotez, paying attention and keeping plugged in with what we're talking about at the Baker Institute, following the Immunization Partnership, which is our nonprofit. We're kind of keeping an eye. We're sort of that point and kind of doing the dirty work in terms of monitoring what's happening, providing resources, providing education so parents are well informed and empowered to make their decisions, talking to their lawmakers. Again, the policies allow us to do what we're doing, whether it's allowing a provider to educate and to vaccinate. And so if we don't have the right policies in place to nurture that, then all the work we're all doing is totally a waste of time. We have a responsibility and our duty to make sure that that is being communicated to those decision makers, because they hear a lot from the other side. They don't really hear a whole lot of the people who say, wait a minute, I want access to vaccines. You're taking away my ability and my freedom to get, myself or my family access to life-saving vaccines. That's a hard no. That's a hard stop for me.
Getting educated what this is all about, because I think too often we call it misinformation or infodemic, like it's random junk out there in the internet, and it's not. It's organized. It's politically motivated. We didn't go after the politics went after us, and it's financially motivated. I mean, have you ever wondered, Heidi, why there are always antiparasitic drugs, ivermectin, hydroxychloroquine, or fenbendazole? It's because there's a lot of it around, and it's cheap, and you can buy it up in bulk and then repackage it, put your own label on it, jack up the price, and you sell it with a $1,600 telehealth visit. It's incredibly corrupt. But unfortunately, the business model for them to be successful, they feel, needs to denigrate mainstream biomedical science and seek to discredit the vaccine scientists. And that's why we come under attack, because we're bad for business. And so they gotta go after us. People need to understand that. And it's not only the parents. We're in a situation now where the primary care providers are really feeling this and feeling demoralized. And the pediatricians, the internists, the family medicine docs, the OBs. They're made to feel like they're not keeping up with the literature. Well, they are. They're just not keeping up with the fake stuff. I can't keep saying enough how important it is what the Baker Institute is doing, taking this very seriously and not doing the duck and cover, which happens all too often in our universities because they're getting afraid to speak out, not talking about it in a partisan way. Sometimes we make the mistake in biomedical science saying you can never talk about politics. It's fine to talk about politics. You just shouldn't be partisan in your viewpoints. And we're not. I don't think any of us really care what your political views are. That's your right as an American. Just don't adopt this stuff because it's so dangerous for the health of your kids and your family. And that's what it's all about, saving lives.
Yes. Well, from the children's perspective, they don't get to choose. We have some additional obligations as people who care for children to really think about what they need. Parents have a choice, of course, as advisors and recommenders. The children are not able to speak for themselves and make that choice. We do want to take on these issues from the evidence side of things, not from the Republican Democrat side of things, because this actually is outside of that. And so thank you guys both for being here and for being so open and honest and helpful. We're going to be continuing this conversation in a variety of ways over the next year. Whatever Texas decides it's going to do, we're going to continue this conversation. This has been Child Health Advocacy and Policy, a podcast from Rice University's Baker Institute. You can learn more about today's topics and access resources we discussed in the show notes. This episode was produced by Caitlin May, with production support from Leslie Marie Aguilar, Ed Bailey, Shannon Moriarty, and Kevin Young. Check out our other podcasts or subscribe to our newsletters at bakerinstitute.org. Thanks for listening.